welcome to Academia Platform, and God bless you abundantly. We want to consider operating theater, nursing, and anesthesia. Presenting is Mr. Malambo. Now, the main objective for this particular unit is actually to impart knowledge in the students so that they are able to offer comprehensive nursing care and safety to the patients in the operating room and a recovery room, and also provide an environment in which the surgery can be carried out. Though it is a specialty area of study as a nurse, okay, as a nurse has to undergo a special training to be called an operating theater nurse. So it aims to expose students to the basic techniques used in the operating theater. That is actually what the wider the lesson is. Now, there are basic terms that are used in the operating theater. Okay? We have basic terms that are used in the operating theater. The first one is operation. Operation, what does this word mean? So operation is an invasive type of treatment where an incision is made into the body tissue for the purpose of repair or removal or entrance into the body cavity. So basically, operation, it is just a type of treatment where you make an incision into the body tissue for the purpose of repair, or rather to remove something, okay, anything that could have invaded the body, to say. That term, we call it as operation. Okay, now what about operating theater? What does the word operating theater mean? So operating theater, as we can see, is a room or department of the hospital in which the surgical operations and diagnostic procedures are carried out. So basically, this is a room or a department in the hospital where surgical operations, where treatments, okay, where treatments are actually made, to say, and diagnostic procedures are carried out. Now, that particular room, we call it as operating theater. Now, what about operating suite? Okay, what is the operating suite? So this comprises the operating room and the immediate accessory accommodation. So it comprises of the operating room itself and the immediate accessory accommodation. We call that as operating suite. Now, what does the word peri-operative mean? Peri-operative. Now, this is the total surgical experience, which includes pre-operative, intraoperative, and post-operative phases of patient care. In other words, these are phases of care that is given to a client, or rather a patient, and it is totaled. Okay, this is the total surgical experience that includes one, pre-operative, meaning the care you give to a particular patient before they are exposed to the operating theater. Okay, two, the intraoperative, okay, and post-operative, meaning after they have been operated on, the care you render after they have been operated on. So basically, the peri-operative is made up of three things: pre-operative, intraoperative, and post-operative, okay, care that is given to the patients. What about anesthesia? What does this mean? So anesthesia is actually the absence of feeling in a part or the whole body, okay, the absence of feeling, okay, or rather the removal of feeling, I can say in simpler terms, okay, on a certain part of the body, or rather the entire body. We call that as anesthesia. Now, what we need to know is that the operating theater is actually made up of four access zones. All right, it is made up of four access zones, the departments, or rather operating theater departments. So under the environment, okay, there are two types of operating rooms. Two types of operating rooms. The first one is called single theater suite, and the other one is called twin theater suite. Now, the lighting and ventilation of operating theater room should be okay. What about lighting? The operating theater must not admit natural light, as this may actually cause glaring and forms shadows. There is a need for good general lighting, which is ceiling mounted and arranged to have an even what is called illumination. So this light source must be dust proof and easy to clean. Now, the types of operating theater lighting. And this one, number one, we call it as multi-reflector luminaire. Multi-reflector luminaire. What is this about? This is where we have what is called the scheeletic. This type of lighting has an optical lens with a single lamp of about 100 to 150 watts and has metal reflectors which are heavily polished. Another type of light is called multi-lamp luminaire. This type of lighting has 6 to 9 separate lamps. Each lamp is about 40 watts and are placed in a single housing unit. We are still under lighting and ventilation of the operating theater. What about ventilation? There should not admit free circulation air, no window placed. Therefore, there is need for good ventilation system that will minimize infection and provide comfort for both the staff and the patients. The temperature in the operating theater, it should actually range from 20 to 22 degrees Celsius. Humidity from 50 to 55%. There are types of ventilation systems. The first one is called the plenum ventilation system. This system is fitted on the roof of the building, sucks air from the environment, purifies, humidifies, heats and cools the air, and pushes the air at a high pressure through its diffusers. So the highest pressure is in the operating room, and the lowest is in the dirty corridor. To say. The other type of ventilation system is called ultra cleaning ventilation system. This is an advanced system used in vascular and transplant surgery, reduces post-operative infection by about 0.6%, pushes air through its diffusers at a high velocity, covering the operating theater area of 2.8 square meters, and it is about 90% efficient. Okay, so in the theater, we also have what are called theater hazards. Now, theater hazards are as follows. One, we have gas pollution and explosions, diathermy burns, needle sticks injury, unsatisfactory disposal of ships, wound infections, electrical sparks, technological advances, and expanded role of the nurse, fault designs, absence of signs, and so on. How do we prevent the infections in the theater? Number one, cleaning of the theater by daily damp dusting, major and minor cleaning. Cleaning all articles before sterilizing them. Have an efficient, reliable sterilizing system, which is autoclaving machine. Have an acceptable packaging method that allows articles to be delivered in a sterile manner. Wrapped articles must meet packaging standards. All articles used in the operation should be sterile. So sterilized persons must touch only sterile things or other areas. Sterile persons should avoid leaning over sterile fields. Sterile persons should not touch areas below sterile fields. Sterile persons should keep their hands within sight and above the worst level. So persons with flu, cuts, and skin infections should not be allowed to scrub. Change of outside clothes to the operating theater gear. Use outside and inside knife. Change glove when punctured. Wear face masks. Minimize talking. Cover operation site if any delay in the operation. So, infections preventive measures, what are they? Number one, meticulous hand washing, decontamination, and use of appropriate antiseptics. Maintain antiseptic technique. Wear protective clothing, such as surgical gloves, masks, headgear, sterile gown. Use of, biohazards, polybags with right coloring system. Use of sharp boxes. Sterilization. What is sterilization? So sterilization is defined as the rendering of articles free of microorganisms, including spore-forming organisms. We are still under the environment of the theater. We are rounding around this fact, the environment. So, sterilization, as we have defined it, is rendering of articles free of microorganisms, include spore-forming organisms. Methods of sterilization. Number one is called dry sterilization. Number two is called cold sterilization. What do we mean, or what are the examples of dry sterilization? One, autoclaving, high vacuum and high pressure autoclaving. Examples of cold sterilization: use of chemicals, e.g. Sedex, Formalin. Storage of sterile articles and equipment. How do we store these sterilized articles and rather equipments? Store sterile articles in moist, free places, dust-free areas. Supplies, equipment, and preparation for operation. How do we supply these things? Number one, supplies is suturing materials. About suturing materials, surgical sutures are classified into two different types of absorbable and non-absorbable sutures. You must know this. They can also be classified based on their construction. monofilament and also multifilament coating, provided whether they are natural or synthetic material. Absorbable sutures. These are sutures get absorbed in the body tissues. They can be natural or synthetic. Natural absorbable. These are what we call chromic guard cut, plain guard cut, collagen, living tissue like fish or ladder. Synthetic absorbable includes, the Dijon Maxon and also what is called the polydaxonol, which is basically PDS. Now, non-absorbable sutures, what are these? These do not get absorbed in the body tissues. They have to be removed when healing takes place. They can be natural or synthetic, like natural silk, warm cut thread, lining, cotton thread, etc. What about synthetic non-absorbable? We find these nylon, Demalon, and Prolene. Others like metallic sutures made of titanium as ligatures and sutures. Now, monofilament sutures, which is called polypropylene sutures, like nylon, stainless steel, etc. What about multifilament sutures? This is where we find what is called polyglycine, silky polyester, PGA sutures, and etc. All these are basically sutures that are equipments prepared for operation, to say. Disinfectants, that is number 2 from the supplies, equipment, and preparation for operation. Number 1, we looked at suturing materials. Those were the ones discussed. Number 2, we go now to disinfectants. These includes liquids and some solid chemical substances like Savlon, methylated spirit, iodine, phenol, Jik, chlorine, granules, antiseptic soaps, and other things. Number 3 material is called surgical supplies. These includes latex, gloves, surgical gloves, needles, syringe or tubes, etc. And number 4, we find equipments. This is where we find the theater table and its accessories, drip stand, diathermy machine, ventilator, cardiac monitor, pulse meter, and also BP machine, Bose machine, suction machine, myo table, kick bucket, swab rack, stools, suture rack, trolleys, etc. All these particular equipments are there in the theater. How do we then handle these particular equipments? So handling of equipments. All equipments must be handled with care and must be cleaned and maintained according to the specifications. An example, the endoscopes. So qualified personnel must attend to 40 equipments promptly. So questions may be constructed from these friends. They may ask you to name 2 types of operating rooms. Number 1, single theater suite and twin theater suite. They may also ask you to explain about lighting and ventilation of the operating theater room. Okay, we've got lighting and also the ventilation. Remember, each particular factor has got 2 as explained. They may also ask you to define terms such as operation, operating theater, operating suite, peri-operative, anesthesia. So make sure that you follow these. They may also ask you to explain the four zones, access zones in the operating theater department as explained earlier on. They may also ask you to explain about the theater environment, where we talked about design and construction, walls and floors, and other considerations when the making the environment, rather the theater room. Thank you so much, and thank you so much for hearing us and listening to this lecture. May God bless you abundantly.